Hi, happy Monday. Here we are again, our Facebook Live event this Monday. We're featuring Dr. Martin Bales is going to go over a brand new treatment and protocol. I want to remind you that we want to reach out to all of you to make sure to share this with all your family and friends. We are a community here at Cancer Center for Healing and Center for New Medicine. So next week, we're going to start a new series. Know that we do everything here from common cold to autoimmune, natural hormone replacement to cancer. So we're going to go over and we're going to broaden that to really try to teach you. We always post on Facebook Live. We'll probably start posting both on Center for New Medicine Facebook and Cancer Center for Healing Facebook. So take a look there and please join our healthy community. And so with that, here's Dr. Martin Bales.
Well, thank you, Kitty, and again, happy Monday to us out there. Thank you for tuning in. So I have spoken previously about such therapies as acupuncture, PEMF, which is pulsed electromagnetic field, photon therapy, thermography, and heart scan, which is a heart rate variability. But today, I have a new toy, and it's called FullScan, or F-Scan for short. So a little bit of history for the FullScan. It's technology out of Switzerland. It's brand new to me, as this device is brand new, but this is the 4th generation, so this is actually called FullScan 4, in a family of devices that started some years ago. And what this really brings to the table is the ability to detect parasites, bacteria, viruses, and substances that are in one's body with pinpoint accuracy. We do have other technology here at the clinic that can say to a patient, okay, you have parasites or you have bacteria, but you don't know what it is. This actually lists them by their Latin name. And so you know exactly what you have. Now, I say exactly, it's not going to be 100% a blood test, but it's a 2-minute scan, so it comes quite close. This FullScan is not it's not a treatment, it's a diagnostic. So it says what you have, but we have other therapies here at the center, such as vitamin C, glutathione, to strengthen the immune system to help fight the pathogens. Dr. Shannon also does full blood ozone, which is really good. It's been shown to kill a lot of the bugs. And we have ultraviolet blood irradiation, where the full blood is irradiated with ultraviolet and blue light, and that's also been shown to help. So this is for the patient who wants to know in a couple-minute time period exactly what's going on, maybe why they're tired all the time, and without spending thousands of dollars on blood work. Okay, so it's pretty easy to use. It has a module that's connected to USB, so that's right here. And then out of the module, or to a finger clip, and the patient would hold my hand. We're actually going to do a scan here in a second on our wonderful patient from out of state here. And we'll go through what the findings are and everything. So the module connects into just a standard PC laptop. The results are scanned in a couple of minutes and then correlated to a table. For those familiar with Dr. Hulda Clark or Dr. Royal Reif, those frequency lists are in there, meaning they took the time years ago in some cases to correlate what bacteria, what virus, what pathogens respond to what frequencies. So the F in FullScan or F-Scan is a frequency scan. We're scanning a range of frequencies that we can preset, and we can change different ranges and also change the resolution of which we're scanning to acquire the data. If one were to think of a sonar or radar type system, that's what we're running through the body. It accomplishes this by putting a very minute current, doesn't shock you, you don't feel anything, through the body and sees what comes back, much like a radar system is putting out a frequency and seeing what comes back. A couple of ideas for pre-treatment, pre-diagnostic scan are no lotions applied to the hands, and also an environment which is a bit more conducive to this sympathetic nervous or parasympathetic nervous system, which is a relaxed, calm environment. So this isn't the ideal environment. We're just going to use it for that. Okay. Okay. So I think we'll go ahead. So I'll have our wonderful patient place this in her left hand. And if you could remove the ring.
Okay.
And just want to set
How about
her.
action bracelet? Okay.
The other metal. And can you send just?
And that's all I'm taking off.
Yeah, that's fine. Yeah, well, thank you. Can you set them like right here, just so they're not touching the
Yeah.
body? Yeah, that's fine. Yeah. The leather is an insulator, so it'll be fine. Yeah. And then we apply the finger clip. You put it on our Southern California driving finger. Just right there. Okay. There we go. Make sure that everything's in contact. That's good. So I will share the results once I complete this scan. Like I said, it just takes a couple minutes. So, and please, you can think as loud as you want, but no talking while this is going through. I'll allow you to see the screen. Actually, go. You can see the progress on here. It's just a couple minutes, so you'll see it work its way over. Okay.
Can you put my glasses on? Okay.
As you can see at the center, we are full service.
Yeah.
Right. Okay, but relax. Caitlin, can you check and see if there's any questions coming in? Does anybody have any questions here as of right now?
So my understanding is that for her to move her arms or to talk, things that would stimulate the central nervous system, right, might skew the results and give a positive hit where there was not
Nothing,
a positive hit.
So the question was, her understanding was that for her to, the reason she's not speaking or moving her arms in any kind of manner was that it can give a false reading, hit, if you will, in the frequency spectrum here when there really is nothing, and that is correct. We're a little over halfway done.
So Dr. Bells, what are you doing now?
So it's scanning her right now, almost done, and it's going to chart out a graph, which I'll show, of different hits, meaning different frequencies that her body's responding to, and that is where those frequencies will be correlated to a table that came up by Dr. Reif or Dr. Holder Clark. I think there's a few more of them in there too. So, okay, it's finished. Thank you so much. Okay, so what I think I'll do. Do you want me to turn this around? I'll go through with you as well.
Okay.
So this is is it visible?
You know, it's got a little bit of shine in it. I'm moving. There we go.
Better?
Nice. Hopefully everybody can
There we
see
go.
this.
So we can see it scanned from a base frequency over here over to an upper frequency over here, and there's different peaks, and the peaks are what we are interested in. So now we're going to have the computer correlate those peaks to the specific pathogens.
That's great. Now, are we going to watch you do that, or?
Yeah, it'll take about 1 minute. Okay, so the computer's going to analyze. Okay, and it's sorted by what are good matches
Can't really
versus not
see
good.
it.
No? Okay, let's go.
It's very small print, but.
Okay,
but you can
I'll
walk us
read a
through
few.
it.
Yeah,
Walk
so you
us through
can
that.
see. Okay, no problem. So what I'll do is I'll show.
Okay.
You want to stand up?
Stand up. Okay. Now, is it true that most people have some type of parasite?
That's a good point.
So I'm not going to be some kind of freak.
No. So the question was, is it true that some people have? Yes, everybody has parasites. It's the air we breathe, the food we eat, the water we drink, and so if it comes up with something like E. coli or something, it's not that you're going to die or that you're going to be very sick. People can have just very small amounts of this, and maybe it'll never hurt them. Some of these I've looked up, and I'm not a cell biologist with these long Latin names, but I've looked up on Google, and it says, is a benign intestinal bug, so
Okay.
it's not, so everybody has something, so don't freak out,
Okay.
basically. So we had shown on there before, but basically what is in green here are the best matches for you.
And what are
So-
those?
And, ironically, tooth plaque 2.
Tooth plaque has been a while.
Okay, so it's been a while. So that's not necessarily, you know, gonna
Okay,
damage
I'm
you.
due,
I mean,
I'm
you're
due.
due. You're due.
I'm due.
That's all. You know.
It's true.
Okay, and a little bit of the EPV, the Epstein-Barr,
Really?
and a little bit of the Streptococcus. There's a couple other ones on here, but they're not real. They're not really high in the
Interesting.
line. And
Okay.
if people recall, or you can, all of this fuzz is background noise. So we're just worried about those peaks.
Interesting,
Yeah, because
okay.
everybody has background noise
Okay.
associated with it. So your scan doesn't look really bad. Your highest peak was 17. It goes up to 100.
Oh,
So that's
good
not a
news.
big.
That's great,
Other patients I've scanned, and you have about 3 or 4 peaks. That's about average, I'd say.
Okay.
Other patients I've scanned have had up to 10 peaks and been up to 50.
Ah,
You know,
pretty clean.
where so it's actually pretty clean. Now
Well, that's
you had
exciting.
mentioned before you were doing a
I
little
was-
bit of a prep.
I was treated about a month ago for liver flukes, which were quite pronounced, and I had quite a reaction to clearing them, but I'm wondering, is
Let
that
me
showing up at all?
Let me scroll down here a little bit. That's a good idea. So once we go down far enough, you see it goes from green, it turns into
Okay,
red.
so that's interesting,
The
right?
red is not. We're not going to worry about anything further
Uh-huh.
down because it's not a good match.
I got you.
So we don't prefer. So the flukes, I recognize the Latin name, and they're not on here.
And what about the candida, which is so prevalent with so many people, and it's,
Yes, it's a peak of 13
oh,
out of 100. So that's not
That's
that's
for
a
me.
little, so a little bit,
Okay.
but not terrible. But it did pick a little bit up. I would say that's about average. A lot of people, like you said,
Okay,
a lot of
that's
people-
great.
Question for me.
So, the machine, the F-scan, is generating frequencies based on the index from Hulda Clark and Royal Rife. It's shooting the frequencies into the body as she's holding the instrument, right? Her central nervous system is having a response. Your machine, the software program, is recording those hits, and then what will you do as a result of those hits? Will you recommend to her doctor or show those to her doctor so that they can recommend supplements, or do you have a technology to then treat
Zap
with
'em maybe.
frequency treatment?
Yeah. Okay. So the back of on the former part of your question, just so everybody at home can hear. So she was asking a little bit more. I'll go through how the machine works. So the machine is putting out a.
I'm gonna ask you something, you
Oh,
want me
sure.
to sit down now?
You can.
Yeah.
You're excused. Thank you so much. You're a wonderful
Thank
patient.
you,
So
Ellen.
thank you. The machine is putting out a range of frequencies of which I specify, irregardless of Rife or Clark. Those are coming up in the table. So it's not just putting frequencies out; it's putting out a whole range. In this case, I scanned from 300,000 to 450,000. That's the general range where a lot of these bugs are. But you can, or one could put in any number of ranges if they wanted, or scan along those. And then you're correct. It's like a radar. It's putting out, seeing what comes back on the peaks, we'll call them. And then it's correlating those frequency peaks to the Rife, Dr. Rife and Dr. Hulda Clark tables
Okay.
there. And then in further answer on the second part of your question, and I think I mentioned it before, but we have a range here at the center and at Cancer Center for Healing, going from immune boosters such as vitamin C and glutathione,
Yeah.
to Dr. Shannon has the full blood ozone, to the ultraviolet blood irradiation. So far, that's what we have. This is brand new, and I'm going to be looking into what we have as far as preparing possible supplements for certain diseases or certain bugs. I don't have a table right now that says, okay, if you have this bug, then you take this supplement. That would be nice, but I have to research that further. We are going to be bringing some other equipment in here that's an invention of my father and a little bit of mine that's going to be programmable with these different frequencies, and we've already been trying this out in a clinic in the Bay Area of taking this frequency information and then programming it into a treatment device that uses pure light, somewhat like Rife, but I have to do a little bit more experimentation with that.
I have a question.
Sure.
There is a virus that many of us have, like if we had chickenpox as a child.
Mhm.
Is it the Coxsackie virus, or it's a virus? And once you have chickenpox, it stays with you forever. Is that coming up at all? Does that
For
come
yours,
up?
and yours, the herpes simplex 1 is coming up.
Which is that virus?
Which
that
is
comes
that
off of-
virus,
Which comes
yeah.
off of the chickenpox. So
If
it
you
is.
see that or the zoster, and that is, for you, it's a level of 16.
So that's
So it's
interesting,
low.
because that is something that I've had as a child. So that's good to show that it shows up, because if it didn't show up, then that would be like not
A
so
little
great.
bit, yeah. The simplest one also, there's a herpes zoster. There's a few other herpes. Was not that you have,
Yeah,
but I
yeah.
have seen before.
Correct.
This has actually been so sensitive, it's been picking up the latest flu vaccine.
Right. Question.
Sure.
Now, so some of my things were showing up at the level of 17.
Mm-hmm.
Can you speak to like what level is it that a doctor might say, you know, at this level we want to treat? Like, do you treat between 0 and 10 and after 10, or is it 0 and 20, or?
Okay, so the question was, we were mentioning the intensity or the height, the
Yeah,
amplitude of
yeah,
the
yeah.
peaks correspond to between 1 and 100 of intensity range.
Yeah.
And many of our patients were 16, 17, which I consider low.
Right.
I think we're going to set the bar here at 15.
Interesting.
Certainly anything, I may even set it at 20, anything under 15 is just background noise. It's
Okay.
just this buzz, which is usually not very reliable. Certainly if a patient has a known, such as Lyme,
Yeah.
which has come up on here before, Lyme is actually a triplicate infection usually, that we would go for treatment. This is more used as an okay, you know you have Lyme, but guess what, you also have X, Y, and Z. One success story I've had so far is I had a patient come in, scanned, and it was a weird Latin name. I looked it up on Dr. Google, and it came up and it says is known in the wild hare, H-A-R-E, the rabbits. Okay, population and also domesticated bunny, basically. And I'm thinking that this thing is not working. And in fact, her family had raised rabbits when she was little.
Wow.
So she had probably been carrying that for a long time. Now, was that causing her ill health? I don't know, but it's probably something to try to get rid of.
So Epstein-Barr can cause you to have like low energy and a
Fatigue.
lot of different fatigue and all those things. Not necessarily my thing, but if it's at 16, is it something to watch, or is it just something to know, or?
So the question was, if something comes up with an amplitude of 16, I'd say it's something to watch. Something to watch. And the beauty of this, much like other non-invasive imaging and diagnostic technologies we have at the centers, you could do this every day.
Right, so if it started to climb,
Then you
you
would-
would know it was activated.
Then you would know that something's going on. And also with our treatments and our therapies, it was to fall, which we would hope. We would know that the therapies, so it's a metric, right? It's a good measure of how our therapies are working or not working. The other that it has in this, we had scanned one of the administrators when I first got this, and it came up and it said sorghum syrup. Well, sorghum syrup is not a pathogen. It's not necessary. It's just an ingredient which some people are. And exactly, I'm getting looks. That's what I said. I said this thing's crazy. Well, the individual that was scanned had decided to go gluten free and was eating a bread every morning that was sweetened with sorghum syrup.
Wow.
So you have to do a little bit of investigation.
So you have to
with some
do
of these things.
right, and I don't have patients tell me first. I just sit them
Yeah.
down and just and run through the different what they have.
Interesting.
Question from the audience.
Okay, so we have an online question. It's a good point. So if you they just tuned in, but we want to make sure if you do a scan and that becomes a baseline,
Okay.
then do they follow a treatment protocol and then they come back and do the test? How does that work?
Yeah.
Does this test treat to like an on-demand or no? What's
Okay.
the difference?
So, in the answer to the first part of the question, thank you for viewing, by the way, is that the second part, this is just a diagnostic. This isn't a treatment right now. I've discussed a couple of the treatment already. To the first part of the question, a patient can use this as a baseline. Usually, patients that opt to have this are people that are here because they're sick, whether they have cancer, whether they have Lyme, whether they have a central nervous system disease, and so we're seeing kind of what bugs are partying in their body. And we can use this, as I mentioned, as a metric, and then do some of our therapies and see if they go away. Now, what I've noticed so far, and I've just had this a couple weeks here, is you don't know if it's a chicken or the egg. In other words, if a cancer patient comes in and you scan them and they have 10 peaks that go up to 50 or something, we don't know if that's what caused the cancer, or because they have the cancer, that it's suppressed their immune system so much that they've allowed for what's called opportunistic infections. So we don't know which one it is, but we do know that they have these peaks, and perhaps through some of our therapies we can get rid of them or lower them so the patient's body can fight the cancer or Lyme or anything else.
So I'm curious, so I had been treated for liver fluke,
Okay.
and I wasn't sure yet if I was done. And did you say that it was at 16?
the patient asked that she had a history of being treated for the liver flukes, and then we just scanned, and those did not come up.
Which is really strange because, I wasn't sure if I was done or not, so that's interesting.
Okay, so could be. I'm not going to say this 100%,
but then you can look further, but you can feel kind of assured that you've made great progress, because mine was pretty pronounced.
what you were doing before, and to know, and many people do have liver flukes. They're definitely in this database. I can assure you that because a lot of
very, very common.
at least half the U.S. adult population, at least if not more.
So that's so exciting.
So has them, but for your case, perhaps there's other things that are more impressed upon right now. Meaning the liver flukes don't come up, which is really good.
Right.
But it's maybe you don't have to worry about treating the liver flukes. Maybe we watch and follow you on some of these other. Although
Right.
nothing came up really, but your biggest was 16 or 17.
Right,
So it's
but
not.
the thing is that liver flukes is now pretty much not my problem anymore.
That's what this
That's
test would
exciting.
conclude. Yeah.
Okay.
Yeah. So.
So I know that when you have any kind of electromagnetic equipment run within a period of time near the time you're going to scan, it can interfere with your results. What type of equipment is going to interfere so that a person, let's say, who's had CT scan, MRIs, X-rays, or Rife therapy, maybe they may not be able to see you right away. What's the span of time that they should wait to let the central nervous system get down to baseline again?
For someone that's had a high, to repeat the question, what is the amount of time to allow before scanning for someone that's perhaps done a equipment that emits a lot of radiation, ionizing radiation, or electromagnetic? And I have not read anything about this from the manufacturer, but I can say that if the patient were to wait at least a couple of days to let that go down. Now, that's something, like you mentioned with an MRI, that if that's with a contrast dye, that contrast dye will probably come up, and rightfully so, in the system, right? Because the patient still has that in their body, and that's not necessarily bad. But I think you're talking about to throw the test off, interfere with the test. So you definitely want to, as I said, this isn't the perfect environment for it because it's not a parasympathetic, it's not a calming atmosphere. I would avoid using the real high, anything real high intensity, especially cell phones right to the head or that right before. I think that day is probably okay, but some patients come in and they're on the phone,
Right.
and I think that could probably throw it. And I would wait at least a couple days after having a high ionizing radiation, such as a PET scan or a CT, or an MRI, and certainly other treatments that would affect it too, because you don't want to throw the test.
When it throws it, would it throw it up or would it throw it down?
That's a good question.
Sorry.
The question was if it throws it, was it throw it up or throw it down? I would think in the cases of a lot of EMF, it would change things around and probably throw it up.
Yep.
Yeah, it make things worse. In other words, create more of a false positive as opposed to a false negative, which I'd rather have a false positive if I had to have something, but I don't want to scare patients either.
Right.
So.
Yeah, I would concur, because what you've done by exposure to those things is you've already had a central nervous system response, raising the central nervous system. That machine is a galvanic resonance system, recording or picking up a high central nervous system response to what frequencies are being shot through. And then also regarding cannabis, which is gonna maybe Valium, drugs, medicines.
For 24 hours, and that's alcohol.
Okay,
All of the
alcohol.
There's the depressors, the uppers and the downers, right?
Yeah.
So the depressors are gonna be alcohol and marijuana and some of those, and
Yeah.
then some of the uppers, as we know, would be caffeine, and that would be for a 24-hour time. We're creating a sheet here with all these, a cheat sheet with all of these on there, but
So
similar to
I
other
had coffee
testing.
today, so let's say I had coffee today.
Okay,
Or let's say I had coffee in the last 3 hours, let's just say. Would that throw it up or down?
that was the stimulant, so I think it would throw it up, if
Yeah.
anything. Yeah.
And then if you were to repeat your F-scan on your patient right now, would you get similar results, or would you have to wait? In other words, is scanning would it create a sufficient rise in the central nervous system so that you'd have to wait till you reached a baseline again by waiting a couple days to rescan? Or could you get back-to-back same results if you rescanned her right now?
So the question was, to wait to rescan, can you rescan someone right now, or do you have to wait a couple days for essential? I have rescanned within a couple of minutes, back to back, and had very similar results.
Okay.
It shifted a little bit, so I don't think it's enough to throw it. I haven't done it on 100 people, but I don't think it's enough to throw it. And the reason I did that before purchasing is I wanted to see if this was a random number generator.
Yeah.
Or whether it was really finding the peaks. Now the background shifted. I don't care about the background noise. The peaks stayed relatively the same.
Okay. And did it shift up or shift down slightly?
Well, not in intensity so much, but it shifted frequencies a little bit. So sideways,
But not high or low.
but not higher or lower. Within maybe one or something, but nothing too. Yeah. So it's very repeatable, which is what I was looking for. Because there's a lot of devices out there that you could scan somebody, the random number generators, and wait 2 minutes. And scan them again. And it could be, as you mentioned, that they were putting so much energy in, but I think they've got this down so low now that it's not a big stimulant.
So if you were to take one of her hits, let's just say it was Epstein-Barr,
Okay.
okay, and put her back on the scanner and shoot that frequency for 10 minutes, 12 minutes straight, could you immediately knock down that count to lower
The high or low.
by shooting in that frequency? Can you treat with the frequency that you tested for on her back to back right after you've scanned?
Okay, so this is a diagnostic machine. It's not a treatment.
But have
So
you tried that?
I've not tried it. No,
Okay.
not tried because it's diagnostic.
Uh-huh.
But I could create. I can see the exact frequency of this Epstein-Barr, and I could just scan within just a 2-second scan and see the peak. But if I kept on doing it, I'd have to try that.
Would you do it?
That'd be in the realm of experimental. I can run a few on here. Sure.
Let's-
Run. Okay. Let's have Rebecca.
Laws?
Probably have to do a minimum 10 to 12
And while you
minutes.
do that, I have a question. I don't know if we're gonna wanna keep our audience on for 10 to 12 minutes.
Could you
But we can
edit
talk
it?
about some other things while you do it. How about that?
Okay. I'm setting up. So it came up at 375,000 hertz,
Okay.
and I'm going to scan from 370 to 380.
Oh,
I'm just going to do that just 10,000 hertz, just a really quick scan with more frequency resolution than before, though.
you
'cause
could
we
probably
do-
just do 2 integers up, 2 integers down.
It's a pretty big peak. It's
Oh,
a
is
pretty
it?
not high peak amplitude, but it's a pretty
Wide.
peak. Correct.
Okay.
Correct. Okay.
Okay.
Yeah. That's okay.
Do my glasses
And-
do anything to it?
Is
No.
is the scope of this inputting of frequencies, is it addressing her top 3? Or just
I'm
one?
just doing the one right now.
Just
Just the
doing
white,
one.
just the white speak, just to try. Yeah. Glasses off as well. I had not heard anything about glasses.
I
So
don't-
they have a
don't
little
know.
metal in them, so.
Okay. Just very
You
quick.
can see your eyes, Cindy.
Yeah.
So you let me know when I can ask you another question while you're
Okay.
waiting.
Do you want to go ahead and ask?
Okay, so we have another one from home. So you tell them about, first tell them what you do with PMF, what it is, and then the question is from home. There's a person that has a home PMF and 2000 HT. Should I use more than once a day for cancer and other?
Okay, I can't comment on a device I don't know about.
Yeah.
Actually, that's one. The
What
PMF.
about yours?
Oh, with this device?
PMF,
Oh, the PMF.
which
Oh,
is a
sure.
different
yeah.
machine. That you
Okay,
do.
so in answer to the question for the PMF, the pulsed electromagnetic field that I talked about before, you can use, my device is very high powered here at the clinic, and so I just use it once per day. The lower intensity devices you can use a couple times a day. I'm not familiar with that specific one.
Tell us about your PMF machine.
Oh, okay. So my PMF machine, first of all, PMF is pulsed electromagnetic field, and it's one of the real high intensity machines. It's about the power of a lower powered MRI. So it's going up to 19,000 Gauss Not that I would turn it that high, but that makes the patient physically move. You can see the muscle fasciculation. So if you're wondering if you at home have a high or low power device, if you can feel it and it makes you move, it's a high power device.
So what do you use it for?
We use it for aiding the immune therapies for the cancer center, for the IVs to work better. It actually changes the permeability of the cell walls and helps unclump the blood. So it creates the red blood cells back to a more spherical shape, changes the cell wall permeability to help with that. That's more for the cancer in that side. And then in the realm of pain management, it breaks up scar tissue. It increases ATP, which is the energy currency of the body. It increases blood circulation and it makes the patient feel better right away.
Absolutely.
Also
That's
for
great.
post-surgical and a little bit for wound healing, although we have better things for wound healing here too.
I'm sorry, I have a question. What's the difference between a PMF
Yeah.
and a QRS mat?
Okay, so the question was what's the difference between PMF and QRS? QRS is a PMF mat. It's very, 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 very low intensity. So it probably is maybe 10 Gauss or 20 Gauss. I mentioned mine goes to about 19,000. Ideally, one would want something that is a couple thousand Gauss, in my opinion, from the results that I've seen. So, yeah. But,
So I had a personal experience on your PEMF.
okay.
Did you want to hear about
Oh,
that?
sure.
So I had a cyst, ovarian cyst, the size of a grapefruit. It also had cancer on it, but I did not know until it was excised.
Okay.
And in a vehicle going over a speed bump, I'd scream out in pain. That's how much pain I was in. I was also in a wheelchair to roll into your office for treatment.
Right, yeah.
And you treated me with PEMF, but I'm not sure at what Gauss
Gus,
you used. Afterwards, it was the first time I'd smiled in a month,
Wow.
and the pain was reduced so much that on the way out, when we hit a speed bump, I didn't cry out in pain.
Wow.
That's great.
So it was pretty remarkable,
Wow.
and I'm a huge believer. It's not the only treatment that was effective that you treated me with, but it was one of the most pronounced ones. Dr. Keneally met me in the hallway after treatment, and she saw me smiling, and she says, "Oh my goodness!" She says, "Is that from the PEMF?" And I said, "Yes." And she goes, "I'm making an appointment," because she had some kind of back pain
No.
or something.
So for those at home, patient commented, if I may just paraphrase, patient came in with a grapefruit-sized lesion, had not smiled in a month due to pain. I gave one of the high-intensity PMF treatments, and patient smiled again. Going over a speed bump on the way to the clinic was painful. Going back over the same speed bump on the way out was not as painful.
Not painful at
Not
all.
painful at all. So.
Okay, we have another, and I don't know if you can answer this, Dr. Bales, but see, so Patrick, sometimes our practitioners can answer and sometimes they can't, but we're going to try. Is a near-infrared heat light effective as part of a treatment?
Near-infrared light has shown a lot of promise. That's actually part of my father's latest invention with the photon therapy. That's one of the wavelengths or colors, as we say. It's really good at releasing nitric oxide, which is a molecule which causes vasodilation or opening up of the blood vessels. So I don't know what kind of treatment he means, but it's great for pain, wound healing, range of motion dysfunction. I actually use that with the PMF a lot of times too, both together. So yes, it's very beneficial, and as long as it's pure light, it's non-ionizing, which near-infrared is non-ionizing.
That's
so.
great. I just learned something too.
Okay.
So another question, have you heard of GC-MAT on an injection for immune therapy?
Yes, I've heard of it. That came out some years ago using GC-MAT was bovine source, actually from Switzerland, probably near where this company is. And it was theorized to use it to shrink tumors, but that's outside my realm of practice, so
Okay.
I'm not gonna go there.
All right.
How about cost for your various treatments? For instance, if I were to come in and get an F-scanned,
Okay.
how much would you charge me?
So patient asks cost of various treatments. The F-scan is priced at $75. That includes the scan, which you saw was a couple minutes. It's nothing, and then a basic review of results and a printout. I don't have time to go through all the Latin names on Dr. Google and go through everything, but the printout includes everything. And then, as was mentioned before, a possible rescan in some months after a series of treatments to see, hopefully, progress or what's going on. Okay, so actually I ran it and it came back up about half of what it was.
Okay.
So
what
it
does
was
that mean?
six. So it was 16, which is still low, and then the MD had shrunk down to 8. So it came back up with the same. Well, the same things came up within that. I just ran the really narrow range for her, so that those came up. And I didn't track the other ones, but they look like they're decreased as well because the largest you had this time was 10. So that means that this might have beaten that down a little bit.
It could also
Just
mean.
the diagnostic itself.
Just diagnostic because it is putting out the frequencies. Could be. I'm not
Yeah.
guaranteeing that. Yeah. But at least we had it's
Better.
It's better, but it's replicatable.
Okay.
And it's coming up with what we came up with before, which is what I like.
Oh,
Yeah.
good, okay.
Yeah.
So how could, they're asking how this can help with HCC.
HCC.
I don't know. Okay, so let's go on the next one.
Okay.
What is Rife versus PEMF? Can you go into that?
Dr. Royal Rife was around the time of the Second World War. He was actually in San Diego, and he came up with a bunch of frequency theories that different bugs and parasites correlated to certain frequencies, and that that was more of a diagnostic like this, in that he looked under a microscope, which he invented, and would see the bugs and would basically find out what frequency they resonated at. For those that don't know resonance, it's the lady singing that breaks the glass. Okay, so breaks the wine glass because she sings and it resonates it at that into the wine glass just through her voice lines. But that's what basic resonance. So he had done that, and then in further was watching under his microscope at the various bugs. He got the bug samples from different laboratories, and then to see that he could blast them or explode them, like the glass breaking, to destroy them without using any kind of chemicals or anything like that. So Rife is a frequency set. PMF is over here, and that's pulsed electromagnetic field. It's just a big magnetic pulse that we're putting out for pain management and to change the permeability of cell walls to allow patients to absorb or make more biologically available the IVs. So it's two entirely different things.
That's great. Okay, somebody wants to know how to get a hold of you, and liver cancer is HCC. So,
Hepatic something carcinoma, basically
Yep.
that. Okay.
so she
okay.
had, mine was non-small cell lung cancer was Joe, but we have Laura is liver cancer,
Okay.
and they want to know how the PMF might help them
Okay,
with that.
so the patients are, online are asking about lung cancer and liver cancer. We don't normally just do PMF therapy alone here at Cancer Center for Healing. We do it in conjunction with the IVs because we know that it makes the IVs more biologically available. I just do the PMF alone when I'm doing a pain therapy. So as Kitty mentioned, we do, it's the whole kitchen sink here at both Center for New Medicine and Cancer Center for Healing. It's not just one therapy that's going to kill the cancer. It doesn't unfortunately, it doesn't quite work like that. It's a whole host, and we think it's a synergy of all the therapies working together. It's what gives us our success rates.
All right. I think we're ready to sign off.
Okay,
Is there
one more
anything to
announcement.
conclude?
As I mentioned, have a new device with my father, a medical device company and device, and we are going to be running a trial for dementia and Parkinson's patients. So if anybody, they need to have the diagnosis of dementia or Parkinson's from a medical doctor, preferably a neurologist, but we're going to be running a trial here so that the treatments would be free. It's non-invasive. It just uses photon or light therapy at different wavelengths. And it's going to be about 10 treatments. So please contact me here at Center for New Medicine.
And they contact the main number, the 949.
The main number, which is not 949-680-1880. I'll say it again.
Extension 2.
949-680-1880, extension 2. And you don't have to get, I'll probably be with patients, but just leave a message and saying that you are or have a dementia or Alzheimer's, which is under dementia, or Parkinson's patient, and you'd like to be added to the list for the trial.
And we probably will send out an email blast to all of you. So please make sure you're on our email list, and we'll make sure to let you know when the trial is active and you can sign up. And then one last question, we're going to sign off. Can you use with a pacemaker?
PMF cannot be used with the pacemaker. This is so low that the company says it's okay to use with the pacemaker, but definitely not my PMF. You can use my father and I Photon because it's just light with the pacemaker.
Okay.
Thank you for watching. Happy Monday.